Using this model, we'd now like to demonstrate the handling of the negative pressure wound therapy or active wound drainage. You need a polyurethane sponge and, of course, instruments for sterile handling. For skin cleaning, we use sterile cotton compresses and antiseptics, and in case of injury or maceration, additional skin protection. For sealing of the negative pressure system, we use polyurethane foils. The connection between wound dressing and suction device is established via suction connector or pad. After cleaning the skin and wound debridement, the negative pressure wound dressing is applied. For this purpose, the sponge is cut into the required shape. Often we have to deal with wound cavities. Therefore, the size of the sponge should exceed wound size. Instead of scissors, you may use a scalpel. For the placement of the sponge, forceps should be used. In this way, even small wound cavities can be properly filled with the sponge. Next, skin protection can be applied, for example, using a skin protection spray. Before fixing the foil, the spray film should be dried. For sealing the system, the polyurethane foil is now fixed over the sponge and the adjacent skin. Instead of using the foil as a whole, we cut it into smaller parts. For application, the foil is marked with A and B. This indicates in which order the cover layers are removed. We start with removal of layer A. The assistant fixes the sponge to prevent overlapping with the skin. Next, the foil is attached, starting at the sponge. Now layer B is removed. This should be done in a flat angle to prevent separating foil from skin. Last, the blue stripes at both ends will be removed. We now see the weak point of this wound dressing, the anal cleft. The next foil is taken by both doctor and nurse at once. First cover layer A is removed. Then the foil is fixed in the middle of the anal cleft and smoothed to both sides.
Anschließend wird die Folie zu den Seiten ausgestrichen. Die mit B gekennzeichnete Folie
Then layer B is
wird als
removed.
nächstes entfernt. Zuletzt werden wieder die beiden Seitenstreifen
Last, the blue stripes on both sides are removed. Before fixing the suction pad, the foil above the sponge is incised crosswise.
kreuzförmig inszeniert.
Afterwards, the pad is connected to the suction device. You should think about what side the patient would prefer for carrying the suction pump and align the connecting line to the corresponding side.
Zunächst wird die erste Schutzfolie
Remove the cover foil of the pad.
entfernt.
The paper frame should prevent the pad foil from folding. Again, the pad with the foil is fixed carefully, and afterwards the other cover layer is removed.
Zum Schluss
Last, the paper frame is
folgt die
removed.
Entfernung des Papierrahmens.
Now the wound dressing is connected to the suction device. The pump is activated with the appropriate adjustments. Finishing the dressing, the sponge can be carefully contoured with a finger to prevent overlapping of the sponge and skin. If the pump is making a little noise, you can be sure your negative pressure wound dressing is airtight.